News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you're interested in recovery from addiction, you'll want to watch our show today. Today's show is part of the New Skills for Living 2011 series on addiction recovery. And we have a great guest. It's really nice to welcome back Dr. Barbara Kohlenberg. Dr. Kohlenberg was here with us about 1.5 years ago, and she's very generously come back to share her wisdom and her expertise with us as we're talking about addiction and recovery, and especially the issues of judgment and shame, which are so important in addiction, and then the recovery part of compassion and acceptance and values. So that's what Dr. Kohlenberg is going to be talking with us about today. Dr. Kohlenberg received her PhD in clinical psychology from the University of Nevada, Reno, and she works full-time with the University of Nevada School of Medicine. And Barbara, it's so great to have you here with us. Thank you for coming back.
Thank you for inviting me.
All right. So I guess the first thing that I'd like to ask you is, how did you get involved in this field, this research of looking into addictions and recovery?
Well, I first became interested in addiction, not from a research point of view, but from a clinical point of view. And I think that probably the very first time addiction showed up for me as a topic to explore was when I was a psychology intern at the VA hospital here in Reno. Uh-huh. And I always noticed that the most difficult patients, the ones that people kind of backed away from wanting to pick up on their caseload, tended to be the people that ultimately ended up being treated in the addictive disorders unit at the VA. Mm-hmm. And so I kind of grew to know about patients with addiction problems as people that psychologists didn't really treat, kind of pushed them away. Mm-hmm. And then, miraculously, I was offered a job in the addiction unit. And I thought, I don't know anything about addictions. And I was speaking to a nurse at the VA that said, "Oh, Barbara, you are going to love it." She says, when you are working with an addicted human being, you will find really the most tender, the most hurt, and the most creative person, kind of all in the same skin. And you were made to help people like that. That will be very good work for you. And I thought, okay, I guess I'll try. So that's how I began to be interested in working with addictions.
That's very interesting. And now, what are you doing now in the addictions field?
I have been involved. First of all, I remained at the VA for 13 years.
Oh, okay.
As the addiction psychologist there. Uh-huh. So I really gained a lot of experience in treating addictions. Mm-hmm. Then I moved to the medical school, and I kind of left the actual active treatment of addictive disorders behind, but I began to do research in that area. Mm-hmm. And I collaborated with Steve Hayes, who's a psychologist at University of Nevada, Reno, who was my mentor and my teacher, and then we collaborated on several research projects looking at developing treatments for people with substance use disorders. Mm-hmm. Currently, I am just so privileged and delighted. I'm working for about a half a day a week with Step 2, which is a substance abuse recovery program for women who have children. Mm-hmm. And so I'm working there kind of on a consulting basis, and that's just been marvelous.
Mm-hmm. Oh, that's great.
Yeah.
So if we go back, you were invited into addictions recovery by someone describing these alcoholics or drug addicts as really tender-hearted and like where they really live inside of themselves with their hurt and their pain and their need for recovery. Mm-hmm. So you were invited in with that kind of verbiage or that explanation of the alcoholic and the drug addict. Have you found that to be true?
You know, I want to say that I found both things to be true. Okay. On one hand, yes, these are human beings that suffer the way any human being suffers. And they also call up a lot of judgment. So both are true. My introduction, sort of both strands are true. One being that these are people that suffer like anybody suffers, maybe more so, I don't know. And also these are people that many treatment providers worry about treating. Like, oh, you know, how can I help somebody that is so ill, that is so consumed with a substance, that has lost so much? So I think that I entered the field with sensibilities kind of on both ends of the spectrum. One, these are the hardest and most difficult people you'll ever work with, and two, these are the most tender, fragile, and kind people, perhaps. You know.
Well, we want to hear more about your experience and how you've juggled or how you've put those two things together. And right after this brief break, we'll spend some more time with Dr. Kohlenberg. Hello and welcome back to New Skills for Living. We're talking with Dr. Barbara Kohlenberg about issues of shame and judgment and acceptance and compassion and values. So, Barbara, one of the things that really intrigued me about the work that you do is the emphasis that you place on compassion. Can you talk with us about that, please?
Sure. I tend to be a compassionate person. I mean, I'm thought of that way. I feel like that's a pretty accurate description of me. And at one point, I actually looked up what the word compassion means, and it means with pain. And so what I take that to mean is that when you are delivering compassionate care, you are delivering care even when it feels painful to do so. And I think that it's easy to care for lots of people, lots of different kinds of illnesses. When people are pleasant and fun and they want your help and it's great, and you kind of go into the room or they walk into your office and they're receptive and open, and it feels great to give them care. But it's harder to give care when somebody is angry and bitter and beaten down and full of resentment and maybe not caring much about me. And so that is painful care. That's care that makes me want to walk the other way. When you can actually learn to head into pain like that, I think that's truly compassionate care. So when I think about compassion in addictions, I think both for the provider, the psychologist, or the any kind of the mental health worker, to work with patients that may fail a lot, that may relapse, that may go to prison, that may die. I mean, all kinds of things that are very difficult for the provider to do. So a provider has to learn how to feel pain and proceed in the direction of help. And actually that very same sensibility needs to be imparted to the suffering addict. By that I mean that person needs to, it is my job to teach that person how to have compassion for themselves, because they also have tremendous wounds. They have done things that they're ashamed of. They truly have engaged in behavior that they may have tremendous regret and shame about. They have lost a lot in life. They have disappointment in themselves. They have a lot of judgment against themselves. And so often folks like that will come into treatment with an agenda of, I'm a bad person, and substances actually help me not feel so bad. So in kind of a paradoxical way, teaching people how to be more kind and accepting of their own hurt and pain and memories and their own behaviors and what's been done to them and what they've done to others, teaching them to hold that more compassionately is kind of a very central part of recovery, of treatment and recovery, I believe.
So, Barbara, when you're working with patients who are judgmental toward themselves and angry with themselves, and you're wanting to encourage them to be compassionate, are some of those elements, are you encouraging them to forgive themselves?
No.
So forgiveness is not necessarily a part of this.
Sometimes people have done things that are kind of unforgivable.
Oh, I see.
And so I don't want to ever seem as if I live in some kind of a fantasy land where you can, forgive yourself for being passed out on the couch while your kid was being beaten or something like that. You may never forgive yourself for that. But what I'm hoping to help people do is to not have to forgive themselves or get rid of how badly they feel, but to help them change their relationship with how badly they feel about themselves.
Oh, now we've only got about 30 seconds right now, but can you tell us more about that? change their relationship with?
Well, we all have thoughts and feelings that we might wish that we didn't have. And so many of us can have agendas of trying to beat those things down in order to do well in life.
Yes.
What I will talk more about maybe in the next segment is how to take those thoughts, feelings, and memories and hold them with compassion and head toward a valued life.
Great. Yeah, we certainly do want to hear more about that in the next segment right after this brief break.
Okay.
Hello and welcome back to New Skills for Living. We're talking with Dr. Barbara Kohlenberg. So, Barbara, you had mentioned that in terms of one's relationship with pain, they can actually put their arm around their pain. So tell us more about that, and then what?
Well, one of the things that's crucial when you working with addictions is to get a sense of the whole person.
Okay.
By that I mean there's the addictive disorder that has created all kinds of problems for the person, the drinking or the using of something or other. And that has to stop. Yet it's also important to view their use in the context of that it's been helping them reduce or make tolerable some level of emotional pain.
Yes.
So number one, you have to view the person as an entire complicated person who not only has an addiction and not only has pain, but also has things that they cherish and value in life. And so in beginning treatment with somebody with an addictive disorder, I would always want to wonder, so why do you want to give this stuff up? Or why are you choosing treatment? Well, because the court's making me this sort of thing. Okay, well that's a good reason. What other reasons? How is this helping you, and how is it a barrier to what you value in life? And then we would shine the spotlight on values. And by values I don't mean goals, like I want a new car or I want a new job or things like that. I mean kind of destination points in life, what is most deeply cherished and held, like I want to be loved. I want to be a good son, I want to be a good daughter, I want to be a good mother, I want to help people, I want to make a difference in the world. So you want to help people talk about relationships that matter, talk about aspects of life that really matter to them. And then it's about, okay, so what happens when you start to reduce substance abuse or stop substance abuse? And what it was helping you with, which is subduing really shameful thoughts and feelings. Those feelings start to come up. Memories, perhaps, of your own victimization. Many people that have substance abuse disorders have trauma histories in that they might have been, beaten or raped or abused in some way as children. Not all, certainly, but some. So you take away the substances and the memories start to show up. Also, there's their own failures and disappointments in life, the people they've hurt, the jobs they've lost, the not finishing school, the stealing, the everything that might happen, maybe even the violence they've been engaged in the service of their substance use, things that they feel very, very ashamed of. So part of what treatment would call for then would be to help people have those memories and thoughts and feelings bubble up, come to the surface, very, very painful, and to be able to take a look at those and hold them, in a sense almost put their arm around them as they head in a direction that they value in life. Many people think that they have to have their pain go down in order to live life.
Yes.
I would argue that may not make sense. It may make sense logically, but it may not make practical sense. And sometimes one's pain doesn't go down at all. One's pain might be very excruciating. And then you can learn to say, okay, I know this pain. I'm going to put my arm around you and we're going to, go make a new friend or go sign up for a course that I need to get a credential to support my family or something like that. So it's about really your own history, things that have been done to you and things that you've done to others. Your own history not being your enemy.
And so going back to the relationship with pain, Barbara, so rather than, to learn that someone can let it come up and not have to drink or use or eat or have sex or gamble or whatever to make it go away, but just let it be there. And like you were saying, and saying, now I've got things that I need to do in my life, let's go together. I was like, feel the fear and do it anyway, or feel the pain and do it anyway.
Very much so. Yes, very much so.
Okay.
Yeah.
And you found as a clinician that that's very workable for clients.
You know, I don't really know how else to do it. In other words, some people have come to me for help, and they really have had an agenda of getting their bad stuff to go away. Sometimes that works, in which case they don't usually come to see me. When that works, we're happy. But I think a lot of times that may work to some degree, but it's when it doesn't work that that I think a more acceptance and compassionate-based approach might be indicated.
Okay, I like that, and of course we have one more segment, and we want to hear more from Dr. Kohlenberg right after this brief break. Hello, and welcome back to New Skills for Living. We're talking with Dr. Barbara Kohlenberg about addiction and recovery. So, Barbara, can you tell us from your perspective as a psychotherapist and in the research that you've done, you see a strong role for courage. Can you tell us about that, please?
I think that people that enter treatment in a lot of pain are showing tremendous courage. I think there's few things harder in life than to say, I don't know what to do. Life isn't working the way I want it to, and I am really stuck and I don't know what to do. And courage, I think, is about, number one, being able to appreciate that that's where you are in life. It requires tremendous courage. And then courage in treatment is about taking risks. And taking risks always really involve doing things that are difficult to do, where you actually could feel tremendous hurt. So I think about courage as being very close to vulnerability. And when a person is in treatment for anything, depression, anxiety, substance abuse, there's a great deal about that person and about that work that creates vulnerability. And by vulnerability, I mean that the person is putting themselves at risk for hurt. They're putting themselves at risk to feel things that are very difficult to feel. And they're putting themselves at risk in terms of human relationships because others can hurt them if they're not so well protected. And I think that much of psychotherapy is about helping people learn to take emotional risks, to help them learn to be vulnerable, and to help them be able to survive further hurt, if that's what happens. Of course it'll happen at some point.
And I guess, is that something that maybe a psychotherapist might provide or other people in a group therapy might provide, is encouragement to help someone gather up their courage and to...
That's a really good idea. That's a really good point. I think that therapists, and when a person's in group therapy, I think hope is offered. And I think hope is a form of encouragement. It's a form of, I think you can do what you think you can't do. I know you don't think you can, but I'm going to hold this hope that I think you can dabble in it, you can feel it, and even though every single cell in your body is screaming that this is going to kill you, hurt you, you'll never survive, I'm actually thinking that you will. So I'm wondering if we can experiment with feeling these incredibly fearful, frightening feelings and seeing what happens. Seeing where that takes you.
Barbara, let me ask you, if someone out there in our viewing audience has had a problem with an addiction, maybe they are right now, or they have a loved one who's got a problem with addiction, what are some of the key or the basic things that you would want to encourage them to consider or do? Well,
I think the first thing is I would like to offer hope that people can have huge chunks of their life consumed with addictive disorders, with loving to drink, using different substances, and can have experienced both the harm and the experience that this has been helpful. And that many people, there are many different ways that a person can get help and can learn how to leave the substance behind and progress in life in a way that will require tremendous courage and compassion, and yet can also really help. It can also really offer the possibility of recapturing or capturing for the first time perhaps some of what is most deeply meaningful and cherished and that they cherish in life.
That's wonderful. So the main message is that there is hope and there is a way out and a way through and there's a better life for people. And as we're wrapping up now, we're kind of like in the final minute. And I wish we had about 2 more hours.
Okay.
I've really enjoyed our conversation. I want to thank Dr. Kohlenberg for coming here and sharing her wisdom with us. I want to remind you that this New Skills for Living Addiction Recovery series will continue on here on KOLO Channel 8. Dr. Kohlenberg's show, as well as probably 30 or 40 other television shows, are available on my website, which I believe they're putting up on the screen. That's easeap.com. And you'll be able to see Dr. Kohlenberg and a lot of other people there. We want to thank you for joining us. If this topic is really important to you, I too would like to offer you hope and encourage you to reach out and get some help. Thank you for joining us.